Have you ever been in the middle of an activity and suddenly lost track of your thoughts? Maybe you were in the middle of a conversation and suddenly a detail you were looking for disappeared from your mind. These things become more common as we get older. But if you suspect that your thoughts are suddenly affected and getting progressively worse, as well as having difficulty focusing and putting words together, you may be experiencing what people call brain fog. Brain fog has become quite popular, and there's a good chance that it could be a symptom of other common disorders. What is brain fog? There is no single official definition or medical diagnosis of brain fog. Instead, it can often be described as a collection of cognitive symptoms that people experience. Brain fog can mean many things to different people. It can include any of the following: difficulty focusing, difficulty paying attention, difficulty remembering familiar details such as names, places, and words, slow response times and information processing, general fatigue and lethargy, impaired judgment, frequently losing sequences of thought. When you have deficiencies in these areas, you may feel as if you have memory problems. But the problem is usually the difficulty in taking in information and retaining it. If you are not getting the right information, it is not easy to hold on to it. What causes brain fog? So what causes this information blockage? There is no definitive answer. One idea is that the body's immune system response causes inflammation in the brain. When inflammation occurs, this can lead to a temporary blockage in information processing. Brain fog can also be caused by chronic stress, hormonal changes, or blood sugar imbalances. Brain fog is a manifestation of a type of inflammation or chronic stress response. Chronic stress can have secondary effects. It can affect your sleep, nutrition, and physical abilities. These secondary problems can lead to psychiatric disorders that are linked to it. Below are some conditions that are commonly associated with brain fog symptoms. Pregnancy. During each trimester you experience various hormonal changes. When these hormonal changes occur, your brain tries to restore the balance by releasing and suppressing certain hormones. This constant fluctuation in hormones can cause brain fog and can also be caused by stressors in early pregnancy. In the first trimester you may have more nausea, your diet may get worse. You may have insomnia, or you may be stressed for any number of reasons. All of these can manifest themselves as brain fog. COVID-19. Brain fog has gained popularity due to COVID-19 and related symptoms. This is because brain fog is usually among the top 3 symptoms that long-term carriers of the disease complain about the most. Sometimes symptoms can persist for weeks or even months for those who have COVID-19. Those who have had to be hospitalized in the intensive care unit and those who have undergone heavy treatments are more likely to experience brain fog. But people with long-term COVID, called long COVID, and people in recovery can also experience other symptoms that can cause brain fog. These include problems sleeping, changes in stress and mood levels, and major changes in diet. All of these factors can contribute to brain fog. It is therefore difficult to find out exactly what causes brain fog. One major hypothesis is that brain fog is the result of a cytokine storm caused by COVID-19. In a cytokine storm, the body floods the blood with inflammatory proteins called cytokines. These cytokines help target the virus causing the problem, foreign objects. But they can also cause immune system responses that cause inflammation in various parts of the body, such as the brain. In an effort to protect, they can cause negative effects. Depression and anxiety. Depression and its connection with brain fog is like the question of whether the chicken hatches from the egg or the egg hatches from the chicken. Often one can cause the other. One of the major causes may be neuroinflammation due to the constant activation of the hypothalamus-pituitary and adrenal connection. This is the body's fight or flight response. If your body is constantly in activation mode, it can have negative side effects and manifest itself as depression or anxiety. The brain fog associated with depression and anxiety often manifests as persistent fatigue and a general feeling of malaise. Food sensitivities. Some food sensitivities can also lead to brain fog or an associated inflammatory response. For example, people with celiac disease or gluten sensitivity often report feeling foggy in the head. Blood sugar levels. If your blood sugar levels are low, you may experience brain fog. Irritability, fainting, lightheadedness, inability to concentrate. This is especially true in people with diabetes when the body makes too much insulin. Sometimes you may also experience low blood sugar after meals. Autoimmune disorders. Various autoimmune diseases have also been linked to brain fog. These include lupus, chronic fatigue syndrome, multiple sclerosis, fibromyalgia. When the immune system is under constant attack, it has an impact on a person's brain function. How can I get rid of brain fog? In general, there is no treatment or medication that directly targets brain fog. To directly eliminate chronic stressors, you should focus on improving your sleep, eating well and exercising for 30 minutes every day, 5 days a week. These small daily changes can be effective in the long term and both reduce your immune system response and reduce inflammation. It doesn't have to be a marathon either. All you need to do is challenge yourself every day and eliminate stressors in your life. You also need to take mental breaks throughout the day to increase your mental capacity. Most of us have a tendency to work continuously to the point of no return, at which point we are so exhausted and tired that we are unable to do anything for a day or two. That's why it's important to take 20 to 30-minute breaks and do focused activities like walking, listening to music, closing your eyes and resting before you reach the point of exhaustion. If you have tried these methods or have been experiencing brain fog for some time, you can contact your doctor and find out more about what to do in the treatment process.